Diabetes mellitus is a condition which affects all the tissues of the body, but in this short tape we will look at the effects of diabetes on the nerves and small blood vessels. When stimuli such as heat, chemicals or electrical and mechanical stimuli are applied to our skin, this triggers signals in the smallest nerves, that is, the pain fibres. In this way, these stimuli give rise to sensations of prickle, itch or discomfort. Activity in these nerves also releases chemicals which produce an increased blood flow in small skin vessels near the damaged spot. For example, this arm shows some local swelling and a surrounding red flush, which is typically seen with an insect bite, burn or infection. This response is part of the body's protection and helps to heal damaged tissue and mobilise the body's defences against infection. In some diabetic patients, such a response is reduced because the small nerves or blood vessels are impaired. It's not fully understood why some diabetics develop these complications, but research has found that it is related to high tissue levels of sugars called polyols on the small nerves and blood vessels. We can measure the damage to small nerves and blood vessels using sensitive new instruments, such as the low-power laser Doppler flow meter, shown here. This enables even tiny changes in blood flow to be measured accurately. The test procedure uses controlled electrical stimuli applied to the skin and tiny doses of purified chemicals to provoke microscopic blushes of the skin near the laser probe. These blood flow changes are short-lived and the skin blood flow soon returns to original values. Because these skin inflammatory responses depend upon small nerve and blood vessel function, measuring the blood flow indicates the protective capacity of the pain nerves and the microscopic blood vessels. The function of this damage control system is what is measured by our tests. With these tests, we have observed reduced defensive reactions of the skin in many diabetic patients even before any symptoms of nerve or blood vessel disturbance are noticeable to the patient. We hope that tests such as ours will provide an early warning screen and enable us to identify patients who may be suitable for trials of potentially protective treatment, such as the new compounds like Statil.